Hello beautiful people, welcome back to my channel once again with another new vlog. So guys, in this vlog we are going to discuss regarding endocrinology. So before starting the video, I would like to request you please like, share and subscribe to my channel. Keep supporting me and let's get started with our today's vlog. So guys, as you all know that endocrinology is one of the most important chapter. So let's get started. So now, what do you mean by endocrinology? What do you mean by endocrine? Okay, and endocrinology. So the endocrinology means the study of hormones is referred as endocrinology. Okay, so first you need to know what is hormone. A hormone is a chemical substance that is produced and secreted into the blood by organ or tissue and has specific effect on target tissue located away from the site of hormone production. So this is the definition for your hormone. It is a chemical substance, okay, which will be produced and secreted into the blood by organ or tissue. Okay, so and has specific targeted sites located in our body, and it is a kind of chemical substance, you can say. That is why, because of this chemical substance secretion, and it is targeted on many parts of our body, it has specific sites, we are getting different kind of changes, and these changes we will refer to as what? Hormonal changes. Okay guys, so this is regarding your hormone will be your chemical substance. Okay, and next let's go deep into the hormones, guys. Okay, now hormone classification, I will give you the concise information about the hormones. Okay, not much in detail, but for your prometric and for your remembrance, the concise one is more than enough for you, even if you are going for technician or technologist exam. Okay, so here the classification of hormone is of two types, that is from the anterior pituitary gland, and the second one is the posterior pituitary gland. So guys, in the anterior pituitary gland we have most of the hormones in our anterior pituitary gland, and remaining in the posterior pituitary we have only two glands. Okay, so let's get deep into this. What are the different kinds of glands we have in the anterior pituitary and posterior pituitary? So coming to the anterior pituitary, you have growth hormone, which is one of the most important for your body to grow. Okay, that is growth hormone. Second is prolactin, ACTH, TSH, FSH, that is follicle stimulating hormone, thyroid stimulating hormone, and luteinizing hormone. So these 6 hormones are very much important to remember. Okay, and they also play a very crucial role as well. Okay, from the anterior pituitary gland. And coming to the posterior pituitary gland, it has only two, that is ADH, antidiuretic hormone, which is also called as vasopressin. Okay, and the second is from oxytocin. So these two are from your posterior pituitary gland. So now let's discuss with individuality of each and every hormone. Okay, which are releasing from anterior pituitary gland and posterior pituitary gland. From the anterior pituitary gland, the first hormone which releases is the growth hormone. The effects of hypersecretion. So guys, you need to remember that every hormone have two times, they will secrete two secretions, like hyposecretions and hypersecretions. So it should be normal, it should not be more than the normal level, and it should not be less than the normal level. So increase or decrease in these kinds of hormone leads to certain kind of diseases. Now let us discuss. For example, first we are discussing regarding the growth hormone. The effects of hypersecretion are age dependent. In adults, the resulting condition is called acromegaly, which is a progressive enlargement of the distal parts of the extremities. Okay, in children the resulting condition is gingivitis. So here, if the growth hormone is too much and it is too less, so the hypersecretion, if the growth hormone is secreted more than the normal levels, then it will leads you to acromegaly, and in the children it will leads to the condition called as gingivitis. Okay, now hyposecretion is lower than that of their normal level. In children leads to pituitary gland dwarfism. Dwarfism means nothing but the small stature but proportionally built. Okay, as you can see in the picture. This is the example for a growth hormone of growth hormone. If it releases hypersecretion and hyposecretion. Hypersecretion always refers to the higher levels, and hyposecretion always refers to the lower levels. Next, coming to prolactin. Prolactin hypersecretion cause galactorrhea, okay, or lactation, and is associated with infertility and amenorrhea in women and impotence in men. So this is regarding your hypersecretion of the prolactin. Now, hyposecretion of the prolactin leads to the lack of lactation in the postpartum woman. So prolactin hormone play a very crucial role mostly for the woman rather than the male, and in some male also it will also play an important role. Okay, if it is hyposecreted, then it leads to the lactation in the postpartum woman. Coming to the ACTH hormone, hypersecretion is referred to as an Cushing disease, with symptoms included truncal obesity, hyperglycemia and hypertension. So this is regarding your ACTH hormone. Coming to the what will happen if the ACTH hormone is released hyposecretion, that is lower than the normal level. It will cause the weight loss, weakness and gastrointestinal problem. Next, coming to your thyroid stimulating hormone. Guys, for thyroid, again I will be making one separate vlog, okay, for understanding whole about your thyroid gland, because it is one of the most important topic in your hormones also. Okay, thyroid hypersecretion causes thyrotoxicosis and is the result of either hyperactivity of the thyroid or hyperactivity of pituitary gland, leading to release of TSH level. Okay, this is regarding a hypersecretion. Hyposecretion is difficult to differentiate from primary hypothyroidism. In the thyroid case, you will having different, like opposite of this one, guys. Like if the thyroid is hyper, the person will go too much thin, and if it is hypo, less than, it will be, the person will become like hippo. So you need to remember, I will give you a kind of tip that hypo is nothing but hippo. If the thyroid releases lower than the normal level, then the patient will go on increasing their weight. So hypo, hippo, just remember this one so that it will be easy for you to understand. Hyper, too much thin. Hypo is hippo, like too much obese, too much weight gain. Okay, coming to your posterior gland, that is antidiuretic hormone. ADH is also known as vasopressin, regulates water reabsorption and blood pressure by affecting the renal tubules and the arterioles. Okay, this is also known as vasopressin, and its function is to regulate the water, regulate and reabsorption of the blood pressure. Coming to the hypersecretion, if hypersecretion happened for the antidiuretic hormone in condition referred as a syndrome of inappropriate ADH secretion, SIADH, the disorder occurred in a wide variety of conditions including meningitis, head injury, tuberculosis, hyponatremia. Okay, so now hyposecretion. Hyposecretion of ADH is associated with diabetes insipidus. Symptoms include insatiable thirst, polydyspia and polyuria. This disorder results from the destruction of the posterior pituitary gland or the hypothalamus. So this is regarding your ADH hormone, which is from your posterior pituitary gland. Coming to your last hormone, that is your oxytocin. For oxytocin, there is no hypo or hyper secretion. That is why this oxytocin hormone is released when a woman is giving. Actually, oxytocin is also called as love hormone, okay, otherwise called as love hormone, and it doesn't have any much effects for hypo or hyper secretion. So no known disorders are associated with excess or deficiency secretion of the oxytocin. So guys, this is a small concise way to just remember your endocrinology, just to have a glance glance revision from your endocrinology chapter. This is not much in detail, but I can say this is a very good detail in a concise manner. So yeah, so this is regarding your hormones and mostly important hormones from your endocrinology. Hope you like this video, and I'll also be uploading the MCQs from endocrinology. So until then, bye guys, take care, and please do like, share and subscribe to my channel. Keep supporting me. Thank you.